Hello everybody, Suzanne Kellner-Zinck from Dawning Visions Hypnosis here to speak about anorexia bulimia, continuing on the series on these very challenging patients. One of the problems that happens all too often, especially with anorexics, is the fact that they wait too long to get help. And this is certainly what happened in the case of my sister's friend. I'm not even sure she ever got any real help, because when I saw her, she was so thin, her jeans were falling off her, and she was still sent back to university to continue school as if nothing was going on with her. She had so little of immune system left, she died of pneumonia. Her body could not fight it off. And that was around Christmas time, sadly. She was 17 years old at the time, and this is back in the early 1970s, before we knew as much as we do now about anorexia. She is the first person that I knew pretty well who had this particular eating disorder, though I didn't know that much about it at the time, being only 12 years old. However, it did have a pretty large impact on me. Even more so, after 3 clients came to me, one after the other in 2005, one an anorexic who was in a doctoral program for Russian literature, and 2 Bulimics. One was a videographer, and I forget what the other person did, but it was something to do with the arts as well. All of them had been to multiple in and outpatient treatment programs. None of them felt like they were helped very well in any of them, though they were all at a good weight for their height. The anorexic had a perfect 5'9" bikini body, I would say. But yet with all of them, they had a lot of emotional traumas that had still not been addressed. And this is the cause for the development of eating disorders, people. You know, you can sit there and tell people what to eat, what not to eat, constrain them all you want. But the bottom line is people are going to make the decisions they're going to make based on how much they love themselves and are willing to do what they need to do to take care of themselves. In many cases, especially for my smoking cessation clients, the love of other people, usually grandchildren, who they want to see grow up, get married, do their careers, whatever. Or, in very few cases, they're ready to get rid of the shame and guilt and want to move on with their lives. It's a minority of anorexic patients, unfortunately. The bulimics are much more oriented toward getting help. They are looking at issues such as having permanent gastrointestinal issues from purging their food endlessly. And in many of those cases, too, they either have addictions concurrently with the bulimia or sequentially after they've healed the bulimia, interestingly enough. And many of them are looking for love in the wrong places, as I call it, not having had good or healthy relationships with their father, so they tend to get into relationships with older men looking for that attention, but in too many cases being used by the men involved. And then I've also had some who've had alcohol and drug abuse problems as well. So these are the things that we need to really understand. So what do we need to do to help these people? We have to help them understand that they're special people, that they have a lot to offer the world, and to get them to a place where they can love themselves unconditionally, to do the work necessary. Because as I've said in the other videos I've done up to now, their number one fear is losing their identity, and that's the identity of the eating disorder. It's their best friend, similar to smokers. You know, they know smoking kills, but many of them won't let go of it because it's their best friend. They feel it de-stresses them, it calms them down, even though we know that many of the ingredients in cigarettes definitely, shall we say, stimulants. That's what they are, stimulants. Stimulants do the opposite of relaxation, but for them, they feel it relaxes them, and it's generally the deep breaths that they take, that has something to do with the feeling of relaxation, because when we take oxygen into the brain, that is a physiological way to cause relaxation, which is why we use deep breaths before hypnosis occurs in most cases. Now, I want anyone who knows an anorexic or bulimic to know that these clients can overcome these problems. But we have to have a layered way of helping them. Not only do they have to love themselves enough to be willing to do whatever it takes to confront those really scary things that happened in their past, much easier done in the altered state of hypnosis, by the way, they also have to recognize the fact that they can be helped, because they're used to being brainwashed by the conventional mental health system that they have to have their symptoms managed, so they don't believe they can be helped. I mean, how would you feel if you heard year after year after year after year that you just had to manage these symptoms, it was never going away, you always had to live like this? It's not a good feeling, people. I know sort of what it's like because that's what I was told regarding my manic depression many, many moons ago. But Tad James helped me get rid of it in 5 minutes of timeline therapy. And yes, I did have my psychiatrist follow me for 10 months after she took me off the meds to make sure I was okay. And I was. Because the mind is incredible in terms of what it can do to help people heal. But we have to have the right ways of doing it. We have to understand that anorexia and bulimia are forms of addiction. They are, people. It's about dopamine hits. And when they don't get enough dopamine hits because the dopamine receptors aren't working anymore, they end up doing more and more self-harm to themselves. So they need an addiction component to the program, but not for substance abuse people, which is where they usually find themselves when they go to the treatment programs for some stupid reason. The addiction needs to be related to their addiction. Over-exercising, restricting food, eating tens of thousands of calories in a meal for the bulimics, using toxic means to get rid of the calories they've eaten. For guys, it's about steroid abuse because they're trying to build up their muscles to inhumane largesse in many cases. Some of them do want to be thin, but that's a minority of cases for the males. And all the rest of it, we have to handle that. And the program I developed certainly does include one. It's based on the work of Will Horton, who's a neurolinguistic programmer, trainer, and practitioner. Great scientist. I adapted his work for substance abuse for eating disorders. And it works amazingly well when we deal with the underlying problems of the traumatic events in their lives and getting them to love themselves enough to eat appropriate foods for health and nutrition. Meaning, good nutrition brings a healthy body and mind. So these are the components that we need to have, along with boundaries, because most of these people are people pleasers, and when you're a people pleaser, you don't know how to be yourself. Especially if you've been a people pleaser ever since you're a little kid, because in your household, you'd get yelled at for every little thing and you never knew why or how, because it wasn't really based on anything you did or didn't do. It had to do with the person whose home you were living in having their own problems that were not being dealt with constructively in most cases. That is what my clients have reported to me. I don't know about anybody else's clients or patients. So this is what we need to understand, and this is what we need to do, and this is what we need to get real about. And for you mental health providers who say you specialize in eating disorders, isn't it about time you learned how to help them heal and move on? I mean, would you really want your kid to be suffering with these problems if they didn't need to? It makes no sense. So in the description to the video, I will have my program for training. And if you meet the criteria, you need to be state licensed in order to do this particular program. You can schedule a free video call consultation, and we'll see if it's a good fit. And the price is there. I'm not hiding anything because there's no point in having free consultation calls with people who can't afford or can't figure out a way to afford the program. God knows I've afforded many, many programs over the years, both for my personal growth and development as well as my professional growth and development, because I wanted to be the best at what I did. Truly, that is what it takes. It's not about sitting back and being okay with the limited means you have, getting the limited results you get for your patients and clients. That's not healing. I don't know what that is. Maybe extended pain and disaster? It's my feeling anyway. So, as always, I thank you for spending your time with me till next time. Bye-bye.